Housecall Providers is an asset to the community, having been in business for 27 years. So we provide medical care in the home, and they include nursing services, social work services, spiritual counseling, as well as behavioral health. We partner with community businesses that provide lab work, imaging, such as x-rays and ultrasound, but also podiatry care and dental hygiene. So basically, we provide everything in the home that you would find in the clinic. While all of our patients are different, many of them present with similar challenges such as cognition, mobility, and any kind of problems accessing a clinic.
I was at the point where I've gone through a lot of doctors and they all say, I don't know what to do, you're out of my expertise. I heard that so much, I was losing hope. And then they sent me Housecall. I had to wait a few months before I got on. Molly Anderson was my first doctor. And when I met her, she just put me to ease and told me, oh, she came to my house, and then the nurses, Katie came in, and I met Chaplain Dean. It was like a family that comes in and makes sure you're okay. Before Housecall Providers came in, they were talking about putting me in a group home. I have children, I have this home. I don't want to lose it. It is beautiful and it is quiet and it is amazingly calming and serene for me. The physical, mental, the mind, the body, the spirit, all of it, where you don't get from another clinic.
In June of 2022, we started our behavioral health program, and immediately we got a lot of referrals from our primary care providers. This is something they had been asking for, that their patients had been asking for. I get to go into my patient's space and see them in their own environment, and it tells me so much more about them as a person than if they come into a sterile office and see me. And I just think I get to meet their dog. Sometimes their family is around, sometimes their caregiver is there and brings them a cup of tea while we're chatting. So it just gives me a bigger picture of who this person is. So someone actually coming to their home is huge for these people, and they would not be in therapy otherwise. They often don't leave their house at all. So there was a really big need that we saw, and we decided to fill it.
Upon receiving the mental health here at home, it's really exciting because Sarah Jo would come to me for a while. She's really amazing, and she's not just there just to ask questions, but actually to understand and encourage.
All of us are just like a little family, and it makes me feel like I'm at home and that what we do actually matters to our patients. The biggest piece about care coordination is we are the point of contact for all of our patients. We take down all the information for them. We make sure we relay all the information from the providers, from the social workers, any of the specialist office. We make sure we get your lab results out to you and to the provider. We help facilitate any type of referral, whether that's transportation to getting to your appointments or just talking with your case managers or social work team to making sure that you're on those appointments on time.
I know Housecall Provider, I think for the last 10, 12 years. I've been working with them since I started at Barbur Vista 2 years ago. The reason behind it is the services we get for our residents and availability of their services to our residents and make a big difference because we don't have to worry about getting a transportation, getting a family or having a caregiver because some of our residents bedbound and are not able to move, or it's hard to get them anywhere in the winter, in the rain. When stuff like that happen, it's much easier to have a Housecall Provider, the doctor come to the resident instead of having them to go out. And that was my focus, and the best one, the services they're providing, the care and passion, going beyond to make sure that residents get the care they needed.
Hey, good to see ya.
I had multiple chronic illnesses, but the overriding issue has been chronic pain. It was driving my life. I wouldn't say contemplating suicide, but I was extremely depressed and had real trouble getting out of the bedroom daily. Housecall Providers has been like a breath of fresh air, and it's really made a huge difference. I'm not that person anymore.
Overwhelmingly, I have experienced people, regardless of whether they're religious or not religious, to say that, wow, my experience of spiritual care in the context of a full healthcare team has really augmented the traditional medical aspect of care.
I've been bolstered up, I would say, by the providers and practitioners at Housecall Providers. And if I needed the help, I got it. And I think step by step led to me being much more functional person and having more mobility. Definitely today than back then. I was scared for me back then, but I'm not now.
What keeps me coming to work for now almost 20 years is the fantastic team that I work with on a daily basis. The mission, and also the refreshing contact that I have with my patients and their family. The typical story is that I see these patients in their home, begin to see them in their home, and as the years pass, I see their condition just evolving. You do feel like your relationship with the patient is such that you're becoming the next thing, the next family member. Often, I follow my patients until they pass. And that's such a special part of my life and their life, to have been there for them until the very last breath.